All right, so we're back with Miranda today, and we both wanted to talk to you guys about our credentials and our certifications and kind of the path that we took to kind of get where we are today. So thank you, Miranda, for joining me this morning.
Yeah, it's good to see you again.
Good to see you. Good to see you. So tell me a little bit about your schooling that you went through and maybe some of the certifications that you have.
Okay, wow. Let's go way back when. So I'm a registered dietitian nutritionist, which means I have a 4-year degree. So I have a Bachelor of Science degree in Nutrition and Dietetics.
Okay.
And then to become a registered dietitian, you have to sit a national exam. In order to be eligible to do that, you have to do a supervised practice internship.
Mm-hmm.
They're typically about a year, unpaid, but it's where you work side by side with other dietitians, doctors, nurses, speech therapists, other healthcare professionals, in hospital setting and outpatient setting, communities. To get a wide range of experience. So it's basically like working full time, just you're not getting paid for it.
Sure.
And so after you've done that, then you can sit the registration exam, which is sort of like a national boards exam.
Okay.
And when I was doing my internship, because I loved school so much, I decided to go ahead and combine it with a master's degree. So
nice.
I have a Bachelor of Science, Master of Science in Nutrition, my internship, and registered dietitian. So,
awesome.
So I've got some, background and some experience there. And I have been a dietitian for 22 years now. So
nice. Oh, that's awesome. Very good. Tell us a little bit about your International Olympic Committee's diploma that you have.
Yes. So when I started Grand Traverse Nutrition, when I went into private practice, I really wanted to focus on sports nutrition. That was my passion as sort of an active, person myself.
Okay.
So I had to apply. So the International Olympic Committee program is a global program. So it's available to anybody you have to apply for it. So you have to have a nutrition background or a healthcare professional background.
Okay.
But my professors were the best of the best from all over the world. So sports nutritionists from Australia, the UK, Europe, the US. So we had to, because it was global, it was a work, an online one where we had to listen to monthly lectures. There was reading and research to do. It was a 2-year program, so sort of like a master's degree.
Yeah.
But that gave me a really in-depth background into the science and the research behind the sports nutrition recommendations that are out, and and also keeping up with current developments, because as little bits of new research come out, they update the guidelines and the recommendations. So
right.
So I completed that about 5-6 years ago now.
Yeah.
So
that's awesome. No, I think that's huge, and it's just a testament to much like myself, we've got such a passion for our industry that you want more information, and you want, to dig deeper into that. So I just think that's great. Now, did that count towards any of your continuing education requirements, and what are those like for your profession?
This one did not count towards the continuing ed requirements. For it to maintain my registered dietitian status, I have to complete 75 continuing education hours every 5 years. Those continuing ed hours have to be pre-approved by the American Commission on Dietetic Registration.
Okay.
So at the time I did the International Olympic Committee one, it had not been through that vetting process.
Okay.
But, so not only do I have that, but at that time I was doing another 75 credits. But so that's from attending conferences, tuning into webinars. They allow a little bit of self-study.
Yeah.
Some specialist certifications. So nutrition is such a broad field.
Yeah.
There's pediatric specialists, diabetes specialists, oncology, But this was my way of becoming a sports nutrition specialist.
Nice. So when you do your continuing ed credits, do they have to be geared towards sports nutrition since that's kind of your specialty, or are you still able to stay broad with what you
I could still stay fairly broad, because I work with also, weight management and food sensitivities, food tolerances. I sort of, I have a little broader approach to my continuing ed. One of the things that we have to do is a learning plan. So we have to do a self-assessment every 5-year cycle, where we sort of look at what our knowledge level is, where we want to go. We draw that up, and so then our continuing ed programs that we choose to complete need to align with that. So it's quite an in-depth process. It's not just...
pretty intense, that's for sure.
They really keep us up to date with what's going on. So,
No, I think that's awesome. And again, I think continuing ed requirements are such a good way to keep you current in the industry. And like, for instance, massage just became a licensed state in 2014. So prior to that, there was no guidelines. You didn't have to be licensed. You did not have to complete any kind of continuing ed requirement. And so it just, licensure, continuing ed requirements just help to legitimize, fields. And so, I just think that it's really important. And of course, as you've highlighted, you've got all that experience and all that schooling, that really kind of sets you apart from like someone that's just completed like a nutrition certificate course.
Yeah. And you're lucky that, massage therapists can be licensed in the state of Michigan. Michigan is like one of maybe 10 states that will not license dietitians for whatever reason. It's just part of where they don't want regulation. So in this state, unfortunately, anybody can call themselves a nutritionist. So the difference between a dietitian and a nutritionist is somebody can do a 6-week online course. Your personal trainer can do a side piece, nutrition certification that may, take them, a few months to do. So they can sort of call themselves nutritionists, but only people that have been through the education process that I have can call themselves a registered dietitian nutritionist.
Okay, gotcha. No, that's good to know the difference, because I've heard those two terms used so interchangeably, but that's good to know, the difference, in terms of seeing, different folks advertising and different qualifications.
Yeah. And often I just say I'm a nutritionist if I'm introducing myself to people, because it's a little bit more user-friendly. People sort of can identify with it a little more. I think registered dietitian, sort of people think hospital setting. But there is, there's so many, again, nutrition is such a broad field. There's so many different places that dietitians work. I mean, schools, for sports teams, in community settings, with food producers, food manufacturers. So there's,
that's cool.
The media now. So, there's, there's
you could be a consultant.
Yes.
Very cool. So, well, just out of curiosity, because I know I get the question a lot at my office, do you take insurance? And we can certainly talk about my portion of that later, but with you being, in private practice, being a, registered dietary, nutritionist, and having all that schooling, how does that affect you with billing? Are you able to bill insurance?
I don't bill insurances. And part of this, I think, comes down to the licensure. So while I know some of the health plans in Michigan say that they do cover nutrition counseling, what is not clear is that it's got to be nutrition counseling that comes through your doctor's office.
Okay.
So if there are any physician offices out there with registered dietitians, that's great. There might be a few in some of the bigger cities, but so that's sort of their loophole. But I do have a national provider identification number.
Oh, nice.
So I can accept if you've got an HSA or a health savings account or a flexible spending account that's attached to your health plan, you can use those funds.
That's cool.
For sessions with me. Anything, for anything nutrition related. It doesn't have to be medical.
Okay.
A lot of the insurances typically cover nutrition counselling if there's a diagnosis attached.
Yeah.
So whereas I can do stuff that's more preventive through the HSA and FSA programs.
Nice. No, that's awesome. I do the exact same thing. It is so time consuming for us to try to take on, taking insurance and then hunting them down and getting your payment. Yeah. That most folks who do massage who work for a medical office like a chiropractor, so few health insurances cover massage, but when you're working with a medical provider like a chiropractor, they can bill on your behalf. So it kind of sounds like it's similar.
Yes, yeah.
For your field. Yeah.
And like you say, I mean, it's basically a full-time job doing that insurance billing, and that's what the medical practices have. They have full-time staff, so
absolutely.
It's just not realistic to do it on an individual basis.
I hear you. Yeah. I hear you. Yeah, the HSA and FSA accounts are awesome. They work for my office as well because we do medical massage. So, for anybody, listening, just know that that's kind of a loophole and a great way to kind of use your monies. Yeah. So very cool.
So we've talked a lot about me. We've talked a little bit about your continuing ed credits, but to get to that point, what did your training involve?
Yeah, so for me, I had already had my bachelor's degree from Michigan State in 2009 when I graduated, and my bachelor's degree is in animal science. I was pre-vet for 2 years, ended up going with an agriculture management direction. So jack of all trades, master of none, and decided to go into massage in 2014. Did some research. I was still living downstate at the time, and the Ann Arbor Institute of Massage Therapy really spoke to me. They focused on sports medical massage. They were very clinical based, which I was looking for. I wasn't looking to go into spa world or anything. And I also loved the fact that the program that they offered was 800 hours, whereas the state only requires 500 hours. So 500 hours is very basic. That's only basically going to get you into something like a spa world type setting. So when I graduated with those 800 hours, I actually graduated with 2 certifications right off the bat. So I am certified in neuromuscular therapy, which is trigger point work. And myofascial release. So very cool to graduate, just hit the ground running, which was awesome. I know that program in that school has since closed down. Jocelyn Granger, who is phenomenal, decided to retire, rightfully so. So I was very lucky to get in when I did. So again, state of Michigan only became a licensed state in 2014. So when I graduated in 2015, it was an interesting time. Massage therapists now have to take the MBLEX, which is very similar, we say same but different, to the NCLEX, which is what nurses take. You have to pass that to become licensed in the state of Michigan only. There's, like, for instance, I'm from the Michigan-Ohio line, so my license doesn't necessarily transfer. I can't go work in Ohio. That's a different application, same but different, as far as them accepting the MBLEX, but they also have different requirements for what you've met with continuing ed requirements. State of Michigan requires 18 credit hours every 3 years, so it is the same as like a real estate license. In those 18 credit hours, you have to do a one-time human trafficking course, which is, good to have, I think, for any industry. And then every 3 years in those 18 credits, you have to have at least 1 credit that's pain and symptom management, and then at least 2 credits that is ethics and kind of personal and professional boundaries. So again, it just helps to legitimize, our industry. Massage really wants to be considered medicine and healthcare. So I love that Michigan got on board with that. It's still new, so, the licensing department for the state of Michigan is still trying to figure out kind of how to regulate us a little bit, but it's at least a step in the right direction. Yeah.
And now, but you can work anywhere. You did something extra right so that you can work in any state in the U.S.
So what I did, so I got nationally board certified. Some states accept that, some states don't. It doesn't necessarily allow me to work in any state. It just holds me to a higher standard of ethics. It was actually required for my application to do the volunteer program for sports medicine through the Olympic Committee. And I think it's a great thing to have. It's a whole nother exam. Some states only require that. I can't think of those states off the top of my head, but other states require that plus another type of, licensing exam like the MBLEX. But it has its own set of criteria as far as continuing ed credits. Those I believe are on a 2-year cycle instead of 3. It was a really hard exam. I never want to take that again, but I'm glad it's behind me, and I'm glad that I've got it.
And that's just like ours. There's no dietitian will ever let their continuing ed credits lapse. You don't want to sit that exam again.
Yeah, I hear you.
Yeah. Well, so you can just see, and I think our education and our experience really, is reflected in what we can offer our clients.
Absolutely.
Our expertise.
Absolutely.
It's not just hearsay or whatever's popular. It's actually, there's actually some meat behind it.
Absolutely. So, yeah, I decided I do sports and medical massage, and with the sports side of things, that's kind of where I've taken a little bit more interest. And I'm constantly, that's what most of my continuing ed classes are, is furthering my learning in that, or I'm reading published articles, or I'm watching, videos that come across through the different professional organizations that I belong to. And it's just, it's that desire to want to know more to make us kind of a little bit more well-rounded and more knowledgeable.
Yeah, yep.
Absolutely. Yeah. Awesome. Well, thanks, Miranda, for joining me today. Again, it was great to chat with you and so good to see a face. So,
yes, I know.
Good deal. Well, we'll chat soon. We've got more information coming. So.
Yeah, okay. Yeah, I look forward to talking to you next time.
Sounds great. We'll see you later.
Bye.
Bye.